In consultation and in collaboration with partners, Unicef will carry out a rapid assessment of the situation of children and women. This situation analysis will determine the exact nature of the crisis, potential developments and the implications for children and women's rights, programmatic response, operational modalities necessary, and security. This will draw upon data compiled in the preparedness phase. This rapid assessment, which is the gathering of the right type of information, takes place in the first 72 hours of an emergency and aids UNICEF officers in making decisions on the action that they should take in the first 6 to 8 weeks of the emergency as per the core commitments for children in emergencies. With the proper information about the situation on the ground and the exact needs of the people at hand, it becomes much easier to decide what is needed in any affected region and in what quantities. It is important that the rapid assessment information should be integrated and included in the Office's Emergency Preparedness and Response Plan, EPRP, in the section dealing with assessment plans and arrangements. Inevitably, the rapid assessment will be a multi-agency effort. It is essential that all partners agree on a common methodology and assessment tool before an emergency so as to avoid wasting time in extensive discussion and negotiation. The Multi-Sector Interagency Standing Committee's initial rapid assessment tool has been developed specifically for this purpose.
The print labs, we do have we've seen them here with the INGC, but probably what we did is, plastic sheets so that the people can use them to cover the latrines. People are a little bit lazy to cut, trees or whatever to build their latrines.
Okay, so sorry, Ben. You're talking about transit centers.
Not transit centers, we're talking about resettlement centers.
The resettlement centers, you cannot, repeat, cannot use plastic slabs, please.
Sheeting.
No plastic sheeting, no plastic slabs.
They're doing bricks and
Resettlement centers with bricks and proper latrines.
But for the time being, what should people know? Where should people go for this? Where to go? That's the situation now, and it's raining a lot, and people have been going out in terms of So we think that this might. I don't know.
That's the thing. You refer to Kaya, talk with Kaya, with Jeremy and Manisa. It's something that we have a long discussion with Director Zukula. It's a major issue why latrines have not been built since last year in all the resettlement areas. It's a big issue. It's been addressed by Kaya.
The Operations Center plays a major role in crisis management and emergency response. It becomes UNICEF's focal point for all time-sensitive information, crisis management, and response coordination. Increasingly, UNICEF offices entering emergencies are establishing operations centers as essential information, coordination, and dissemination hubs to expedite response actions.
This is the Emergency Situation Center, or CITSEN, for the Mozambique Country Office, which has been established and activated for this emergency response based on the experience of the 2007 floods and cyclones responses, where we established this CITSEN for the first time. And this is the coordination and information sharing hub for the emergency response. It's where we have all of the tools and systems which are facilitating the coordination of the response, and also the liaison with the field bases, which are set up in different locations throughout the flood-affected areas.
The Operations Center is always equipped with proper equipment and staff to ensure that the coordination efforts run smoothly without any hitch. Officers ensure that departments such as that of data collection and IT are always up and running. While linking the officers who are in the field with those back in the center, it creates a better and bigger picture of the whole scenario and thus allowing for quick and sound decisions to be made.
Okay, well, some of this discussion I think is bilateral, but again, for the other who is based in Sonoy Kaya are asking about the balances of BP5, and they're trying to ascertain how much BP5 is available in the field in different locations and whether there's a need for more BP5. And linked to that, there's the question of whether we can replicate the kind of training that was done by DDS in the areas around Kaya, the camps around Kaya, whether we could. Details of the discussion will need to be taken up separately, maybe by email between Chris and the 3 locations.
Since the core commitments for children were first formulated at the Martinique Global Consultation in September 1998, the organization has become increasingly clear regarding the nature of what constitutes an effective response for UNICEF. When an extraordinary response is required, the core commitments for children outline UNICEF's minimum commitment in health, nutrition, water sanitation and health promotion, child protection, education and HIV/AIDS. In addition, UNICEF will meet its operational commitments in security, human resources, supply and logistics, fundraising and communication, and finance and administration. Among the areas of UNICEF's commitment are health and nutrition, for which UNICEF commits to promote access to essential and quality health and nutritional services. Through this, all children between 6 months and 14 years of age are vaccinated against measles, or at least children between 6 months and 4 years of age are immunized. In collaboration with partners, UNICEF ensures that based on rapid assessment, it provides child and maternal feeding and also supports infant and young child feeding programs alongside World Food Programme and other NGOs. Screening centers that are normally based in different areas affected by a crisis help in identifying malnourished children who need specialized treatment.
The activity here that we are observing is a mobile team that is conducting vaccination, vitamin A supplementation, deworming and nutrition screening. The nutrition screening works like this. The children are first measured, mid-upper arm circumference, and then those who are in the yellow part of the tape are less than 12.5 centimeters are also weighed and measured. And then those who are less than 80% weight for height, but above 70% are given what is called corn-soya blend, which is a mixture of maize and corn and multivitamins. Those children are considered moderately malnourished. So they receive this flour, this corn-soya blend, and they take away a little bag for two weeks, and then they come back to be measured again and weighed and see how they're doing. All the children are given vitamin A supplements, which are useful for the children to fight infection, and children with vitamin A deficiency have problems with their vision as well. So all children up to 5 years old get the vitamin A, and also all the children above 12 months get dewormed. Many of the children here have big bellies and probably are carrying a big load of worms, so every 6 months they need to be dewormed. The children who need vaccinations are also given vaccinations. That's the children less than 1 year old are given their routine vaccinations. And any children who have problems with their eyes or diarrhea will receive treatment or will receive referral for treatment.
UNICEF also organizes information and advocacy platforms through which people are educated on how to prevent the spread of diseases such as malaria by using mosquito nets appropriately and washing their hands in order to prevent communicable diseases such as cholera. Provision of health and nutrition education, including the importance of breastfeeding and safe motherhood practices, is also a priority for UNICEF under health and nutrition. Another key commitment area where UNICEF is involved is water sanitation and hygiene. In order to ensure the access to safe water for women, UNICEF, in collaboration with other partners, will always ensure that there is supply of safe drinking water while still putting into consideration the privacy, dignity and security of women and girls. Chlorine, bleach and other water purification tablets and a detailed user guide and instructions in the local language is also provided. In addition, UNICEF also provides water handling materials such as jerry cans and their user instructions in local languages on handling of water and disposal of excreta and solid wastes. Items such as soap are also provided to the people while disseminating key hygiene messages on the dangers of cholera and other water and excreta-related diseases, while facilitating the safe disposal of excreta and solid waste by spreading messages on the importance of keeping excreta buried and away from habitations and public areas.
Our partner SEDIS will lead the process of distribution. We're going to follow up how they do if they're doing correctly. And before the distribution, they are going to demonstrate and explain the importance of that supplies for hygiene and sanitation. How to use the jerry cans, how to chlorinate the water in the jerry cans using certeza. How to use the soap, the importance of soap, the prevention of cholera, diarrheas, all that things. So we have to do that with that demonstration. They've got activists here, which normally they work here every day. So they will do that process using the local language.
Lero tabwereza pondo sempre dia zingafamba tinabwereza kuzapasa porque mipindu tiri kupasa pang'ono taverana tiri kupasa pang'ono.
Under education, UNICEF commits to the promotion of access to quality early learning and education for all children in affected communities with specific focus on girls. In order to ensure that this is realized, UNICEF, in collaboration with its partners, will in the first 6 to 8 weeks set up temporary learning spaces with minimal infrastructure and resume schooling by reopening schools and starting the reintegration of teachers and children by providing teaching and learning materials and organizing semi-structured recreational activities. Other than the initial response, UNICEF will re-establish or sustain primary education by providing education and recreation kits and basic learning material and teacher training, as well as promote resumption of quality educational activities in literacy, numeracy, and life skills issues such as HIV/AIDS, prevention of sexual exploitation and abuse, conflict resolution, and hygiene.
We're here to, as part of the education component of the response, to support the emergency here in the flood-affected provinces of central Mozambique. Right behind me is Nyamvu School. As you can see, it's in a pretty bad state. It has about 300 students normally, and then because of the floods, an additional 100 children have moved in from the surrounding areas, flood-affected areas, which are all around us. And so the idea is to provide additional classroom space to an existing school in the form of this tent which is being put up. And then to complement this, or it's a very important component with education materials, which are teachers' kits, school kits and learners' kits, which are not here yet. First we want to get the tent up. So we are working here with the government, of course, the INGC, which is the National Institute for Management of Disaster Management, and they have a military unit that's seconded to the government to manage some components of the response. We have an agreement with the government to make use of the soldiers who you can see behind us. Here, there are 6 here. There's 2 teams of 6 who are in Kaya district at the moment putting up the tents.
Under child protection, UNICEF takes the obligation of protecting children and women from violence, exploitation, abuse and neglect. In collaboration with partners, UNICEF ensures that a rapid assessment of the situation on children and women is undertaken, and within the appropriate monitoring mechanisms it advocates against, reports and communicates on severe, systematic abuse, violence and exploitation. UNICEF also provides support for the care and protection of orphans and other vulnerable children, as well as support the establishment of safe environments for children and women, including child-friendly spaces, and also integrate psychosocial support in education and protection responses. UNICEF also assists in the prevention of separation of children from their caregivers and facilitates the identification, registration and medical screening of separated children, especially those who are less than 5 years of age and adolescent girls. In cases where children are separated or are at risk of being separated with their caregivers, UNICEF works directly or through partners to assist in preventing the separation of children from their caregivers, facilitate the identification, registration and medical screening of separated children, particularly those under 5 and adolescent girls, facilitate the registration of all parents and caregivers who have lost their children, provide support for the care and protection of separated children, including shelter, and support partners involved in tracing and reunification and providing tracing equipment as required. In regards to humanitarian work and staff, UNICEF undertakes and promotes humanitarian activities in a manner that minimizes opportunities of sexual exploitation and abuse. All UNICEF staff members and partners also sign the Code of Conduct and make them aware of appropriate mechanisms for reporting breaches of its 6 core principles. In cases of armed conflict and in accordance with international legal standards, UNICEF works directly or through partners to monitor, report on and advocate against the recruitment and use of children in any capacity during armed conflicts. It also seeks commitments from parties to refrain from recruiting and using children during armed conflicts and negotiates for the release of children who have been recruited. UNICEF also within established mechanisms monitors, reports on and advocates against the use of landmines and other indiscriminate weapons by both state and non-state actors and coordinates mine risk education. The prompt delivery of appropriate supplies is a major part of relief work. In any emergency situation, therefore, the ability to deliver and use items immediately for life-saving purposes takes priority. It is therefore important that the supply staff work in a close relationship with the program staff. As much as the delivery of items for life-saving purposes is important, effectiveness and efficiency in procurement and delivery of supplies in emergencies does not mean discarding of the procedures, but instead it calls for focus on advanced planning and preparedness, immediate action taken at the outset of an emergency, paying attention to local arrangements, and establishing an emergency task force and backup team led by the head of office. This task force should be on standby at all times to constantly assess the situation and set the ball rolling in the first instance.
My approach is being in the warehouse. That's where you learn more, even especially when you're new. If you want to know what is going on around, there's no better handover than being in a warehouse for at least 1 week. Every day when you load, offload, and then from the people here you learn where the thing goes, how the normally go, and you can probably manage to modify or to improve the system, but you need to be there every day, not only here, also where the goods are offloaded, to take care of them, to be accountable for that, which this is quite an issue because it's quite difficult then to report properly, but to get the thing done is necessary to be there where the goods are, and because we are here to deliver, I'm here to deliver, and that's my job.
As soon as an emergency situation is declared, emergency needs in the various program interventions must be rapidly assessed and thereafter periodically reviewed. As part of the preparedness, supply officers in country, area and regional offices, particularly those in disaster-prone countries, should keep a suppliers list and profile updates with emphasis on suppliers of items likely to be required, suppliers' stock capacity, available transport and distribution services, and transport routes and capacities. Obtaining proper maps and having knowledge such as the condition of roads, the type of weather to expect, may help in deciding what to be transported when and which mode of transport would be the best to use.
You wanted to go the jerrycans together with the certeza.
No, let's put it in this. Yes, let's put it in this way. They cannot use the jerrycan without certeza, but you know, if it's a question of the day, yeah, we can just get ready and send them.
The other thing is, if we put the jerrycans, this is a small boat,
yeah, but this is a very small one, huh?
Yeah, so we don't take much jerrycan.
What do you think?
Yeah, but then you have to distribute out of the roadblock from Maromeo.
Yes.
So you're going with the truck to the roadblock into Maromeo.
Yes.
And then you up and unload it there.
Yes, we send the truck today with the jerrycans
with
jerrycans. Soap.
So we're doing jerrycans and buckets the whole day.
Yeah, we're gonna do that. Yes, okay. That's probably the best option.
Okay, good.
So we'll get started with this delivery to them.
Okay, good. So we got the truck already there?
Yeah, this is the truck.
No. That's the truck for setup.
In an emergency situation, the prompt and efficient establishment of all communication equipment options for staff, warehouse and transport fleet is of paramount importance. Thus, the supply division should be contacted for assistance in procurement, setup and training. Equipment such as radio, satellite phones and faxes, etc. should all be set up for simultaneous operation. An effective reporting system should also be established from the onset to avoid duplications, confusion and conflicts. In-country transport and storage of supplies provided by Unicef should normally be the responsibility of the government. However, the country office must ensure that supplies reach the intended recipients while at the same time playing an important role by organizing transport and safe storage facilities during emergencies.